Hi, everyone. Welcome to the fall semester and especially to your first clinical rotations. This is where you're going to start to put many of the things you've learned into practice, and I'm sure you're all really excited to be at this point in your educational journey. But maybe you're also a little bit nervous as you get started on this part of the program. So this presentation came about originally at the request of some of our preceptors who requested that students present their patients in an organized, logical, and succinct manner. And so hopefully this presentation will help you all to accomplish this. And while we're talking about preceptors, I want to take this opportunity to remind each of you that our preceptors are all volunteers, and that goes for even when they are UT Health employees. So therefore, you should be mindful of this as you interact with them. You need to be flexible with your schedule and not expect that preceptors are there to meet your schedule. So let's take a look at the learning outcomes for this presentation. First, after this presentation, you should understand why it is important for you to have the skill to give a good patient presentation to your preceptor. Not only is it valuable for them, it's valuable for you as a developing nurse practitioner. Secondly, you should be able to describe the components of a presentation template that you will use to present your patient. And then lastly, you should be able to see an example and describe an example of how to present a patient both succinctly and logically. So during your clinical practice, you are going to be asked to take a history and perform an appropriate physical exam. And that's likely going to happen before your preceptor even sees the patient. And this means being able to present a patient proficiently. It's actually going to start with your ability to approach the patient's history and physical assessment using a diagnostic framework that starts with the patient's chief complaint and evolves as you take a history and perform a physical assessment. Your ability to do this well also depends on your knowledge of conditions that cause specific clinical symptoms and physical findings. In other words, you will be developing your own clinical reasoning skills that you need to be a future nurse practitioner. So this just doesn't make it easier for the preceptor. You will be practicing the skills that are necessary for your future practice. So your patient presentation, which is the way in which you share what you have discovered when you have evaluated the patient, allows the preceptor to identify gaps in your knowledge, and that also allows them to focus on feedback and areas that can help you improve. And then from a very practical point of view, preceptors are at their job. They are busy, and there's an expectation that they see a certain volume of patients per day. So you also need to be efficient and succinct in how you share what you know after evaluating the patient to help them be able to do their job efficiently. Uh, to be realistic, it's likely that initially you will not be able to present all aspects of the patient presentation from the chief complaint through differential diagnosis and management, but you should be able to take a logical and pertinent history that includes questions that consider not only the likely conditions, but also the don't want to miss conditions presenting with certain symptoms. For example, a patient presenting with abdominal pain, you would want to rule out appendicitis both in your history and physical exam. Now, I said that initially you won't be able to do a patient presentation from chief complaint to treatment and management plan. But as you proceed in your clinical rotations, you should be able to do this. And you should also do it so efficiently that you will also be contributing to the clinic's productivity. So what you don't want to do when you present a patient to your preceptor is to simply regurgitate everything that you and the patient just talked about. While you want to remember that information, and it may be important to include in your charting, or also to allow you to answer a clarifying question from the preceptor, you want to be able to narrow down that information, which will also allow you to demonstrate to the preceptor that you can differentiate from relevant to irrelevant information. So we talked about how you don't present to a preceptor. How do you present appropriately? And there are different ways to do this. Sometimes it depends on the setting. So for example, primary care and specialty care will be interested in different key information. For example, an orthopedic provider is not as likely to care about vaccine status on a child, whereas primary care, that is a very important part of information, especially when you're seeing a child with a febrile illness. However, even though there may be differences between practices, there are common components of a patient presentation, and that is that the presentation should be succinct and logical, should include the most likely diagnosis and also the must not miss diagnosis, and then also tell a story from beginning, middle to the end. So one of the best ways to do this is to create a template that you will use consistently. This helps you stay on track. You don't want to read from your notes when you're trying to describe the preceptor, what you learned from your patient encounter. Another way to do this is ask the preceptor if they have a preference in how you present. Some preceptors have asked students to use SBAR as a way to start, or at least have a foundation for the patient presentation. So this is an example of a template. We have here patient description, so she's a 10-year-old girl. Chief complaint, she's presenting with fever and difficulty. Then going on to disposition, so how sick does this patient appear? As clinicians, it's an important skill that we can determine the severity of the illness of our patient. We know that it's not just a patient's diagnosis that determines their treatment. Their treatment plan can also be determined by the severity of their illness. Think about the diagnostic framework, sharing the diagnostic framework with your preceptor so they understand where you were coming from when you start asking your HPI questions. And of course, you're all familiar with old carts. You learned that in health assessment, but old carts is just to help you remember different components. But remember, your history taking has to be hypothesis driven. So based on that diagnostic framework, based on the diagnosis that can cause the presenting symptoms, and they should always include questions to rule out or rule in worst case scenarios or those can't miss diagnoses. Another point to remember is never ask the patient, do they have any associated symptoms? That is there for you to ask symptoms that you are considering part of the illness script of a certain condition. So instead, you would ask a patient, for example, that has cough and a fever. Are they having difficulty breathing? That is an associated symptom you would want to know about because you're maybe ruling out a pneumonia. And finally, when you are reporting to your preceptor, you want to give them those pertinent past social and family history, pertinent review of symptoms, pertinent vital signs, pertinent findings on the physical exams. If there's any labs or tests, then you want to give those abnormal results. Of course, you're going to include allergies, medications, immunization status if relevant, and then you want to present a possible differential diagnosis and management plan to your preceptor. So this slide is going to show you what the story looks like based on the patient we just saw in the last two slides. So here we are. I just saw 10-year-old Charisse in room 3, and she came in with fever and difficulty breathing. She is mildly tachypnic. She looks kind of droopy, but not in acute distress. I was initially thinking she could have pneumonia, sinusitis, or a viral upper respiratory infection. So in very few words, you have kind of given your preceptor an idea of what the patient came in with, how sick they look, what you were thinking in your differential diagnosis. So now she's synced up with you as far as what you might be thinking. Then you tell her her fever started 2 days ago. She had a maximum temperature of 102.6 at home. Then last night she started to feel short of breath, which seemed worse this morning. There was no coughing, wheezing, or chest pain, no nasal congestion or sore throat, and no myalgias. She's having chills and she feels very fatigued. Her immunizations are up to date, including COVID and flu. She has taken some Tylenol, which helped her fever initially. No past history of similar symptoms. She's had no sick contacts. Currently, her fever is 103.2. Her pulse is 102. Her respiratory rate is 28, and her pulse oximetry is 94%. She is not having any retractions or accessory muscle use, but crackles were auscultated in her right lower lobe. I think, and now you're going to summarize what you think is going on with this patient. I think she has a community-acquired pneumonia, and it's most likely bacterial. She will need antibiotics, and I think she can be treated as an outpatient. So you have really given this preceptor a story about what is going on with this patient, and you did it in a very succinct manner. So in summary, whenever you are presenting to your preceptor, you want to keep the HPI, review of symptoms, and physical findings that you report to them succinct and pertinent. You don't need to say give normal findings unless it will contribute to ruling out a diagnosis or ruling another diagnosis in. You want to start your physical exam with the pertinent vital signs, and then at the state pertinent positives and negatives of your physical exam findings. If there were any lab tests, state the lab tests, or also maybe note what lab tests you would like to have done today. Know the health maintenance status, even if you don't present it initially. And also, if you're there in your clinical journey, you can present what you think would be a reasonable patient treatment management plan. So I hope this has been helpful and prepared you for presenting a patient to your preceptor. Good luck to you all as you start your clinical rotation.